If you have vertigo, you may feel like you're moving or spinning when you're not. Or you may feel like your surroundings are in motion when they aren't. Many people describe vertigo as feeling dizzy, but it's different from being lightheaded. Simple movements are unusually intense for people with vertigo, and the condition can impact your everyday life. Your symptoms will probably depend on what's causing your episodes and the type of vertigo you have. Types of vertigo. The two main types of vertigo are: 1. Peripheral vertigo. Peripheral vertigo is caused by a problem in areas of the inner ear or the vestibular nerve, which connects the inner ear and the brain. 1. This is the most common type of vertigo. 2. Central vertigo. Central vertigo happens when there's a glitch in the brain, particularly in an area of the brain called the cerebellum, or brainstem. Signs and symptoms of vertigo. Symptoms of vertigo vary from person to person. Your symptoms might be mild or severe, depending on what's causing the issue. Some common signs and symptoms of peripheral vertigo include: 1. Dizziness. 2. Feeling like you are moving or spinning. 3. Problems focusing the eyes. 4. Hearing loss in one ear. 5. Balance problems. 6. Ringing in the ears. 7. Sweating. 8. Nausea or vomiting. Central vertigo may cause signs and symptoms such as: 1. Double vision. 2. Difficulty swallowing. 3. Facial paralysis. 4. Eye movement difficulties. 5. Slurred speech. 6. Weak limbs. What does it feel like to have vertigo? Many people describe vertigo as feeling like the room is spinning. It might cause you to feel like you're tilted, rocking, unbalanced, or unsteady. Sometimes these unpleasant sensations are worse if you're standing up, walking, or moving your head around. Many people describe these feelings as physically exhausting and taxing. Sometimes, the sensations are so severe that you feel nauseated or experience vomiting. Usually symptoms of vertigo don't include lightheadedness, fainting, or motion sickness. Causes and risk factors of vertigo. Vertigo isn't a disease itself. Instead, it's a symptom of other conditions. Finding out what's causing your symptoms is one of the first measures your doctor will take in assessing how to cure vertigo. You'll need to know what's triggering your dizziness before you can treat it. Identifying specific risk factors and medical conditions can be helpful. An array of issues can cause vertigo. Some of the most common are BPPV, Meniere's disease, and labyrinthitis. Less common causes include migraines, medication, head injuries, and stroke. Being a woman and being older than 50 can up your risk of having a vertigo episode. A family member with vertigo, or other factors, such as having a head injury, can also increase your chances of developing symptoms. Vertigo, problems with the inner ear. Symptoms of vertigo are often the result of an inner ear, vestibular system, problem. Your inner ear plays a big role in helping you feel balanced. Inside your ear is a tiny organ called the vestibular labyrinth, which includes semicircular canals that contain fluid and hair-like sensors. Other structures in the ear, called otolith organs, help monitor the movement and position of your head in relation to gravity. Otolith organs contain small crystals that make you responsive to gravity. Sometimes, these crystals can break free and move into the semicircular canals. This can irritate the hair cells within the canals and make them more sensitive to head position changes. It can allow for false messages about your body's position to be sent to your brain. Basically, inner ear disorders cause your brain to obtain signals from the inner ear that don't match up with what your eyes and sensory nerves that send messages to your brain, receive. Learn more about causes of vertigo, common risk factors, genetics, and more. How is vertigo diagnosed? Diagnosing vertigo isn't always simple. In fact, it can be a tricky and involved process, because people with dizziness often have trouble describing their specific symptoms. First, your doctor will try to find out if you have true vertigo by asking about your specific complaints. Be prepared to describe the sensation as precisely as you can to help differentiate vertigo from lightheadedness. Then the focus will be on diagnosing a cause. Your physician might inquire about your family and medical history, perform a physical exam, and conduct various tests. They may perform a maneuver with you, called the Dix-Hallpike maneuver, to recreate vertigo symptoms. If positive, this is diagnostic of peripheral vertigo. Other physical examinations measure your balance, analyze your eye movements, or assess what side of your body is affected by vertigo. Imaging tests, such as a computerized tomography, CT, scan or magnetic resonance imaging, MRI, can be used to let doctors see what's going on inside your body. In some cases, hearing tests, vision tests, blood work, and even allergy tests are also used. Each person may require different testing, depending on the suspected cause of vertigo. Prognosis of vertigo. In many cases, symptoms of vertigo will resolve on their own within a few days. But for other people, it's chronic. Living with vertigo can be frustrating. Your episodes may be unpredictable and sporadic. Some days, you may not experience any symptoms, while other days, you might have debilitating bouts of dizziness. The good news is there are effective treatment options, and most of the time, these treatments can help you control or eliminate your symptoms, so you can enjoy everyday activities. Duration of vertigo. Symptoms can last a few minutes, or they can persist for hours. In some people, the vertigo persists for weeks or months. Treatment and medication options for vertigo. Several treatment options are available to help symptoms of vertigo. The canalith repositioning procedure, also known as the Epley maneuver, a popular therapy that involves exercises to reposition canaliths, calcium crystals, in your inner ear, has a success rate of about 80% in helping people with the most common cause of vertigo. Other types of physical therapy are used to relieve vertigo caused by inner ear problems. Sometimes medicines, injections, psychotherapy, or surgery are needed. Your doctor can help you decide which options are best for you. Medication options. Some medications used to treat vertigo symptoms include 1. Dimenhydrinate, Dramamine. 2. Meclizine, Antivert. 3. Diazepam, Valium. Alternative and complementary therapies. What if you could cure your vertigo at home? Your doctor may be able to provide you with detailed instructions for doing modified repositioning exercises, like the Epley maneuver, at home. Prevention of vertigo. Most of the time, vertigo can't be prevented. But knowing and avoiding certain risk factors may help prevent it. For instance, you can protect yourself from a head injury by wearing a helmet when bicycling or playing sports, or taking measures to prevent a fall. Complications of vertigo. Vertigo can take a toll on your daily life. If your episodes are frequent or severe, you may not be able to work, drive, or perform other tasks. Typically, people with persistent vertigo are advised not to drive or operate machinery because these activities can pose dangers to themselves and others. Vertigo can also lead to falls, which may cause injuries. Falling is particularly a concern for older people, who are more prone to bone fractures and other complications. Falling is the primary cause of fatal and non-fatal injuries in older Americans.